Hello friends, welcome to the nursing career channel. Please subscribe the channel and like the videos. सो ਆਪਾਂ प्रीवियस एग्जाम पेपर जो होया सीगा बाबा फरीद ने लिया सी स्टाफ नर्स ਦਾ ਉਹ क्वेश्चन पेपर डिस्कस कर रहे हैं। सो ਅੱਜ 51 क्वेश्चन है। 51 क्वेश्चन हैगा द नर्स इज एडमिटिंग अ चाइल्ड सस्पेक्टेड ऑफ हैविंग hyperglycemia. Which of the following assessment finding would support a diagnosis of hyperglycemia? Select all that apply. Blurred vision, hunger, pallor, polydipsia, tachycardia, headache. सो ਇਹਦਾ राइट आंसर हैगा प्रायोरिटी वाइज किमें करने हैं। ऑप्शन सी इज़ द राइट आंसर। ਇਹਦੇ ਵਿੱਚ ਬਲਰਡ ਵਿਜ਼ਨ ਵੀ ਆ ਜਾਂਦਾ, ਹੰਗਰ ਵੀ ਆ ਜਾਂਦਾ, ਪੈਲਰ ਵੀ ਆ ਜਾਂਦਾ, ਪੋਲੀਡਿਪਸੀਆ ਵੀ ਆ ਜਾਂਦਾ, ਟੈਕੀਕਾਰਡੀਆ ਵੀ ਆ ਜਾਂਦਾ ਤੇ ਹੈਡੇਕ ਇਹਦੇ ਵਿੱਚ ਸਾਰੇ ਇਨਕਲੂਡ ਹੋ ਜਾਂਦੇ ਆ। ਸੋ ਆਪਸ਼ਨ ਸੀ ਇਜ਼ ਦਾ ਰਾਈਟ ਆਂਸਰ। ਨੈਕਸਟ ਕੁਐਸਚਨ 52 ਦ ਕਲਾਇੰਟ ਇਜ਼ ਐਕਸਪੀਰੀਅੰਸਿੰਗ ਸੀਵੀਅਰ ਡਾਇਰੀਆ ਐਂਡ ਸੀਰਮ potassium level of 3.3 mcqs. Which intervention should the nurse implement first? So notify the client's doctor, prepared, administer intravenous potassium, place the client on cardiac telemetry monitor, assess the client for leg cramps. So option D is the right answer. Assess the client for leg cramps. Next question 53. A client dying suicidal ideation come into the emergency department complaining about insomnia, irritability, anorexia and depressed mood. So which intervention would the nurse implement first? Options ne request a psychiatric consultation, place the client on one-to-one observation, complete a thorough physical assessment including lab test, remove all hazard material from the environment. So right answer is option number D. Remove all hazard materials from the environment. Sorry, question 53 ਦਾ ਹੈਗਾ option B. Place the client to one observation. Next question 54. Question 54 हैगा the 8-year-old client diagnosed with the vaso-occlusive sickle cell crisis is complaining for severe headache. Which intervention should be the nurse implement first? So options ne assess a client neurological status, B administer a narcotic analgesic by intravenous push, administer 6 L of oxygen via nasal cannula, increase the client's intravenous rate. So right answer हैगा option B. Administer narcotic analgesic by intravenous push. Option B is the right answer. Next question 55. The nurse is assessing the bishop score on the post dates client. Which of the following measurement will the nurse assess? Select all that apply. Cervical dilation, fetal station, cervical position, rupture of membranes, gestational age. So question number 55 the answer हैगा option A. A, C, D, E. Cervical dilation, cervical position, next rupture of membranes and gestational age. A is the right answer. Next question number 56. Question 56 हैगा in assessing a child thyroid status, which of the following assessment finding should document on subjective finding? So 56 the question the answer हैगा fatigue. A is the right answer. Next 57. So question 57 from a patient who underwent thyroidectomy 2 days ago, which laboratory values requires close monitoring? So options ne potassium level, next calcium level, white blood cell count, sodium level. So option B calcium level is the right answer. Option B. Next 58. Which symptom experienced by a client diagnosed with schizophrenia would predict a less positive prognosis? Options ने hearing hostile voices, having little or no interest in work or social activities, continuously repeating what has been said, thinking the TV is controlling his or her behavior. So 58 the answer हैगा B, having little or no interest in work or social activities. Next move to the question number 59. A patient with sinusitis is going home with an antibiotic prescription. Discharge teaching will include: go to the emergency department immediately if any headache occur. Next option B, breathe in cool air via humidifier every 2 hours. C, use decongestant and antihistamines conservatively. D, follow fluid restrictions guidelines. So option A, go to the emergency department immediately if any headache occur. A is the right answer of question number 59. Next question 60. An important role of the nurse is to facilitate social interactions between a patient who is paranoid and patient's peer. The nurse implements this intervention based on the understanding that the patient with paranoid personality disorder, so options ne is gregarious in socialization style, tends to exhibit loose boundaries when sharing feelings, likes to be around large group of people. D, tends to be isolated and lacks social skills. So option number D, tends to be isolated and lacks social skills. D is the right answer of question number 60. Next question 61. A patient becomes angry and aggressive towards the nurse after speaking on the phone with his mother. The student nurse recognition. This is which coping mechanism? Displacement, transference, projection, substitution. So option A is the right answer. Displacement is the right answer. Next question 62. Nursing may be defined as the diagnosis and treatment of human responses to health and illness. This definition of nursing was given by options: Nightingale, American Nurses Association, Henderson, World Health Organization. So option B, American Nurses Association is the right answer. Next question 63. A pregnant woman is hospitalized for treatment of pregnancy induced hypertension in the 3rd trimester. She is receiving magnesium sulfate intravenously. The nurse understands that this medication is used mainly to options ने prevent convulsive seizures, B, decrease the respiratory rate, C, increase uterine blood flow, maintain normal blood pressure. So A is the right answer. Prevent convulsive seizures. A is the right answer of question number 63. Next question number 64. A client is scheduled for orchistomy. Which of the following procedure sports the term of orchistomy? Options: A, partial surgical removal of the penis, B, dissection of related lymph nodes, C, surgical removal of entire scrotum, D, surgical removal of testicle. So option D, surgical removal of testicle. D is the right answer. Next question 65. Which of the following will be abnormal in a child with the diagnosis of hemophilia? Here are the options: A, platelet count, B, white blood cell count, C, hemoglobin level, D, partial thromboplastin time. So D is the right answer, partial thromboplastin time. Next question 66. A patient is admitted to the medical unit with possible grave disease hypothyroidism. Which assessment find supports the diagnosis? A, bradycardia, B, peribordial edema, C, exothermia, D, hoarse voice. So 66 the question the answer है C, exothalamus is the right answer. Next question 67. A client has been receiving lithium for the past 2 weeks of the treatment of bipolar illness. When planning client teaching, the nurse understand that it is important to emphasize the client must maintain low sodium diet. B. Come in for evaluation of serum lithium level every 1 to 3 months. Have a blood lithium level draw during summer month. Take a diuretic with lithium. So A is the right answer. Maintain low sodium diet. 68. The nurse recognized Disney as which of the following options? Increased awareness of respiratory effort, decreased alveolar ventilation. C. Increased rate and depth of respiration. D. Decreased oxygen saturation of venous blood. So A is the right answer. Increased awareness of respiratory effort. 69. When planning the care of the patient who is paranoid, the nurse should include which of the following intervention to increase the sense of trust? A. Give the patient the nurse home phone number for support. B. Spend more time with his patient than with other patients. C. Solicit the patient participation in the development of the treatment plan. D. Fulfill all the patient requests to provide assurance of active listening. So option number D. Fulfill of all the patient requests to provide assurance of active listening. D is the right answer. Next 70 question. These are the very important questions. Please like the video and subscribe the channel Nursing Career. Next question 70. Following are the measure of central tendency except mean, median, mode, variance. So D is the right answer. Variance. Next question 71. A newly admitted client with a long history of alcoholism complain of burning and tingling sensation of feet. So nurse would recognize these symptoms as indicative of which condition? A. Korsakoff psychosis. B. Wernicke encephalopathy. C. Alcoholic myopathy. D. Peripheral neuropathy. So option D. Peripheral neuropathy is the right answer. Next question number 72. The nurse is assessing the laboratory report of 40-week gestational client. Which of the following values would the nurse accept to find elevated above pre-pregnancy level? A. Hematocrit, bilirubin, glucose, fibrogen. So option D. Fibrogen is the right answer. D is the right answer. Fibrogen. Next 73 question. Which of the following finding on a female breast exam should the nurse report as suspicious of breast cancer? A. A poorly defined firm lump that is non-tender and fixed to the skin. B. A soft mobile single lobular nodule that is non-tender. C. Multiple bilateral round lumpy tissue that is tender. D. A single soft lump that is well defined and tender. So right answer is option number C. Multiple bilateral round lumpy tissue that is tender. Question 74. The nurse is caring for a newborn with a neural tube defect. The best covering for the lesion is A. Moist sterile non-adherent dressing. B. Dry sterile dressing. Talfa dressing with antibiotic ointment. Option D. Sterile occlusive pressure dressing. So A is the right answer. Moist sterile non-adherent dressing is the right answer. Next question 75. The male client diagnosed with renal calculi is admitted to the medical unit. Which intervention should the nurse implement first? A. Assess the client pain. Request the client to urinate in the urinal. Strain the client's urine. D. Increase the client oral fluid intake. So A is the right answer. Assess the client pain. So these are the today's question. ਪਲੀਜ਼ ਵਾਚ ਦਾ ਹੋਲ ਵੀਡੀਓ ਐਂਡ ਸਬਸਕ੍ਰਾਈਬ ਕਰ ਦਿਓ ਚੈਨਲ ਨੂੰ। ਬਹੁਤ ਇੰਪੋਰਟੈਂਟ ਕੁਐਸਚਨਸ ਨੇ, ਬਾਕੀ ਜਿਹੜੇ ਰਹਿ ਗਏ ਉਹ ਆਪਾਂ ਕੱਲ੍ਹ ਦੀ ਵੀਡੀਓ 'ਚ ਕਰਾਂਗੇ। ਸੋ ਥੈਂਕ ਯੂ ਗਾਇਜ਼, ਬਾਏ ਬਾਏ।